Congratulations on your choice to use the Perio Protect method. With the non-invasive Perio trays, you can comfortably deliver antimicrobial medicine to the source of the infection below the gums. This treatment is effective and simple to use. When you start the treatment, you'll receive trays and easy-to-use home care tools. There is an upper tray and a lower tray. The upper tray is easy to identify because the front teeth are slightly larger than those in the lower tray. Your dentist will prescribe the best medicine for your mouth. If you have been prescribed a liquid medication, the brush can be used to evenly distribute the liquid in each tooth indentation. Like the trays, the brush needs to be cleaned after it is used, and then put away to use next time. The instruction sheet and other information will give you directions for loading, cleaning, and storing your trays, with reminders how often to use the trays and how long they should be used each time. Let's take a look at how to properly fill and insert Perio Protect trays. Gel medication is placed in a thin line across the tooth indentation. A little medication goes a long way. A thin line is enough. If your doctor prescribes a liquid medication, place a few small drops only in the areas of the tray indicated by your doctor. Using the brush, evenly distribute the medication, making sure it coats the tooth indentation. When finished, rinse off the brush. Take the tray and place it gently over your teeth. Because the tray is custom made for you, it will feel snug. The special seal will gently direct medication below your gums and around your teeth and keep the medication in place long enough to work against the bacteria causing your gum infection. If the medication seeps out of the tray when inserted, you will taste it, indicating that you are probably using too much. Spit it out and put a little less in the tray next time. Follow the exact same procedure with your bottom tray. Medicine, evenly distribute, and place the tray over your teeth. Once you have them both in, spit out any excess medication in your mouth. Rinse out the brush and put away all your supplies. Remember, it's important to keep the tray in for at least as long as your dentist instructed. After the prescribed amount of time, remove the trays and brush your teeth to remove any excess medication. After every treatment, brush the trays with cold water and allow them to air dry or dry them with a clean towel. Use cold water only. Hot or very warm water may cause your trays to warp, and then the seal won't work effectively. The case is an ideal place to store the trays when you are not using them. And don't store the case in a place where it can become too hot. You want to keep trays away from direct sunlight and store them at room temperature. See how easy it is? Most people find that it helps them to remember to use the trays if they do it at the same time they do some other daily activity.
I'll often shower in the morning, shave, and do the trays.
The moment I wake up in the morning, it's the tray in.
I frequently use my trays when I'm taking a shower.
And a lot of times if I know I have to drive somewhere and I've got a 30 or 40 minute drive, I just take them with me. They're in while I'm driving and pop them out when I'm done.
Well, I have a routine I do at work. I go take a little break, put it on, come back, no one knows I have it on.
After dinner sometimes when I'm just watching TV, I will do it.
Once you get started, it's easy to keep going. And not only will you be able to better fight the gum infections, but the medicine should also make your mouth feel cleaner and freshen your breath.
The main change I've noticed since using the trays is fresher breath.
My breath, is better than before, so that's a much plus.
My breath has really improved. Kissing quality at home has gotten a lot better.
My mouth feels so much healthier.
Because my mouth just feels clean and fresh, and it stays that way all day long.
Most people do experience another side effect. The antimicrobial agent can also whiten your teeth.
My wife's always telling me about how nice my smile is, how bright it is.
My teeth is whiter, and I really love that.
Be sure to review all of the take-home information before using your Perio trays. Also, be sure to take your trays with you when you return to your dentist for your reevaluation visits. You may want to check out Perio Protect website at perioprotect.com for more information and frequently asked questions. And once again, congratulations on taking better control of your health.